Here we are on this dark day that you predicted would come. How much darker is it going to get this winter?
Well, unfortunately, I think that January is going to be a bad month. And the reason for that is that we already are at very, very high levels of infection, hospitalizations, and deaths. As you mentioned in the data that you showed very, very clearly, it speaks for itself. The problem is that when you had the amount of travel that we've had, understandably, during the holiday season, a rather prolonged holiday season from Christmas through New Year's, people congregating together, wanting to be together with their loved ones, which is, again, understandable. But what people will do is they likely will congregate indoors with larger numbers of people than they should. And that is a very precarious situation when you're dealing with a respiratory-borne illness. So I would imagine as we get a couple of weeks into January, things could get worse than they are now. I hope that they don't. But when you look at the history of what happens following events like 4th of July, Memorial Day, Thanksgiving, et cetera, it is likely that we'll see an uptick in everything, in cases followed then by hospitalizations and then followed by death. Superimposed on an inflection curve that you showed in one of your charts that you showed a moment ago, that's very, very clearly precarious when you see something go up like that, when you have a baseline of infection of a couple of hundred new cases a day and over 200 deaths per day, 125,000 hospitalizations. The system can't handle much more than that. So hopefully people will listen to the public health measures of wearing masks uniformly, keeping distances, and avoiding congregate settings. I hope that they do that in the couple of days that we have left in the holiday season.
The new variation on the virus that was discovered in the UK is now here. It's been reported in Colorado. It's been reported in Southern California. I've heard you say and others say that it is more contagious. I'm not sure what that means. Does that mean if I'm taking the same precautions I've always been taking, if I am in the presence of this variant of the virus, I am somehow more likely to get it, even taking the precautions I have been taking?
No, I don't think so. I'm glad you brought it up in that context, because that can be misleading to people. If you take appropriate precautions, you don't have to worry about any viruses. It's when people are at that borderline of maybe doing it sometimes, maybe not, that a more contagious virus can slip through the public health measures. So I don't want people to be thinking that if they wear masks, if they take care to make sure they keep social distancing, they avoid crowds, you're going to be okay. When you have a more transmissible virus, that means the virus will take the opportunity under circumstances where people are not practicing public health measures, that it will be more easy for them to get infected. So don't get discouraged. Keep doing the public health measures that we're talking about.
So this new, more contagious version is not more likely to get through my mask.
Well, you really can't say that because we haven't done the study to prove it. But, you always get caught when you haven't done a study to scientifically prove something about a mask. But the fact is that if you double down on your public health measures, extraordinarily unlikely that you're going to get infected. If you're out there not wearing a mask, being in congregate situations, you're going to put yourself at risk. But you can't give a quantitation whether it's going to get through this mask or not. Just do the public health recommendations and you'll be okay.